I want to welcome residents from Santa Clara County and Santa Cruz County, those portions of the 17th Senate District, all of Santa Cruz County and southern Santa Clara County, and our special guests who you will meet in just a moment, Dr. Sonquist Forrest and Dr. Newell. I just again want to lead off this afternoon first with an acknowledgement and an expression of sympathy for family members of victims, family members of those who have been hospitalized, some for long and very tough durations in ICU units, and also to thank all of you who have participated in the shelter in place. We will hear from the doctors the important public health objectives that we have been trying to achieve, and I think with some great success in the state of California, but still not without ongoing challenges and needs. I also want to acknowledge the many heroes who have been stepping up to protect our communities. First and foremost, those healthcare workers, doctors, nurses, hospital staff, and all the support staff, including first responders, and then other essential workers, from farm workers working today as we speak in the fields to keep the food supply moving, other food production workers, grocery workers, and other essential workers, some of our small businesses that have continued to provide services under very tough circumstances. I will be turning over in just a moment to our doctor guests. I do want to share one piece of information of state update from the state of California on unemployment insurance benefits and now the availability of pandemic unemployment assistance, the PUA. That is federal funding for workers who were not employed, who were independent contractors, self-employed. That became available this past Tuesday, and you can apply for that on the EDD, the Employment Development Department website of the state of California. To date, since March 15th, the state of California has put out close to $5 billion in payments to workers. We've been able to turn around within 3 weeks of online application to a direct deposit in your account or a check in the mail. Staff have been working 7 days a week, long hours, including Easter Sunday, and we've bolstered that staffing by over 1,000 transfer employees from other state agencies. We know there have been some delays and waits and frustrations, but we encourage you to be patient, and you can always call our offices if you have questions or ongoing problems. But I just want to give a shout out to those state employee heroes who have been working overtime to try to bridge the gap for so many families who have suffered without work and without paychecks during the course of this pandemic. And with that, I think I will turn to the public health officer for Santa Cruz County. Dr. Newell will give us some updates about the latest shelter-in-place orders and best practices and some of the changing dynamics as we all work to push in the same direction. The mantra, we're all in this together, and we're all in this to support one another, to minimize illness, to minimize unnecessary risk, and to follow best practices. So again, Dr. Newell, Public Health Officer, County of Santa Cruz, thank you so much for joining us. You'll have about 5 minutes. Thank you.
Thank you. Thank you, Senator Monning. It's a pleasure to be here and a pleasure to be with my own Santa Cruz County residents as well as our neighboring Santa Clara County residents. It's been another big week for shelter in place, health officer order release. Most of you know that Santa Cruz County has mirrored the health officer orders of the Central 7 Bay Area counties for the most part, and those were set to expire on May 3 at midnight. So most of us have issued our local health jurisdiction health officer orders this week, and mine were just signed last night and released today after we ensured that the governor's orders around beaches were not going to be in conflict with ours. So our shelter in place order for the next coming weeks has just been released. The order for Santa Cruz County will not have an end date at this point. We decided that it was best to just keep the current shelter-in-place order extended with no end date, but with an expectation that about every 3 weeks we will modify that order, hopefully mostly lifting restrictions as we reopen California again. Our local county roadmap is called Save Lives Santa Cruz County, a roadmap to resilience, and it very much parallels the governor's 4 stages or phases of reopening. Each phase expected to last a few weeks, not months, as the governor has promised. So because our communities have done so well sheltering in place and flattening the curve and extending that doubling time to the point where we have very few cases each day and very few hospitalizations, and in Santa Cruz County, no recent deaths. We feel that it's safe at this time to begin to lift some of our restrictions. And so my orders that were released this afternoon release restrictions to the level of the governor's directives for construction, real estate, healthcare, motor vehicle sales, including other modes of transportation like bicycles, and also manufacturing of bicycles, cars, and other modes of transportation. In addition, we're opening up outdoor workforce. Besides construction, we're opening up gardening, landscaping, arborists, environmental mitigation efforts, garden shops that will support those efforts. Also fabric and craft stores that for the purposes of making face coverings and gowns and other PPE. In addition, our shelter-in-place order in Santa Cruz County, as well as Santa Clara County, it's the same wording, opens up educational and recreational opportunities for children through grade 12 in stable groups of 12. And there's very specific requirements around those that mirror the social distancing requirements. But it's good news because we're starting to work with Parks and Recreation and other departments around summer programs and how we might be able to do day camps and summer programs for people whose parents, children whose parents are working in essential activities. So a lot of good news, a lot of lifting of restrictions. I think our county residents should be pleased with their sheltering in place to date and the good results of that we're seeing. In Santa Cruz County, we have 131 reported cases in the county with 2 deaths total of Santa Cruz County residents from COVID-19. Of that 131, 80 of the cases have recovered. So the majority of our known cases have recovered, and leaving us with few active known cases in Santa Cruz County. The demographics of the cases follow the county demographics closely. So the breakdown into Hispanic and non-Hispanic is very similar to our demographics in Santa Cruz County. And the cases are distributed throughout the county, north, south, and mid-county, very much according to population. So it's an equal opportunity virus.
Thank you, Dr. Newell. Appreciate those updates, and we will be coming back to you with some questions from those who have been able to join us this afternoon. And now it's my pleasure to turn to Dr. Sundquist Forrest, who's a clinical associate professor of medicine at Stanford School of Medicine. She's also on the faculty with UC San Francisco's Family Residency Program at Natividad Hospital in Salinas, and a member and a leader of the California Academy of Family Physicians. She's also been heading up a program for personal protective equipment for Central California. And without further ado, I'll welcome Dr. Forrest and ask you to share your 5 minutes with us. Thank you so much.
Thank you for inviting me, and hello to Southern Santa Clara County and Santa Cruz County. I live in Santa Cruz County and I work in Monterey County, so I feel like I sort of straddle the Central Coast in a different way. I thought I would spend my time just answering the most common questions that come to me right now from patients and also from other folks, and that we would spend hopefully some time going over them a little bit, because it's things that are in the news and questions that people have that sometimes aren't answered in other ways. And they're my top 10 questions as well. So I think if they're on my mind and that of my colleagues and my patients, that perhaps they're on your mind too. So one of the first questions that comes to me is, what is the timing for a vaccine? People keep saying that we went into shelter in place for two things, a vaccine and also for treatment for COVID-19. And the answer is that a vaccine is not in the near future. We see it, we'll see it in 2021 or 2022, but it's a ways away. So as we see some of the efforts coming, we're not within probably a year or 18 months or 2 years away. And the reason is because in order to make a vaccine, we have to make sure that it works and that it's safe. And that means in the US, 300 million doses, and that's injecting it into that many arms, and to make sure that it's safe and that it works. And hopefully that this will happen. But I just wanted to put that out there, that the vaccine is a ways away for us. The second one is, what's the timing for a treatment, even one that's 50% effective? And to look at that, we need to see how effective are our treatments now, and what does that mean? So if we look right now, and this is for people that have test-proven COVID, about 1% of people that have test-proven COVID die, and it's higher for older and sicker people. And we're looking at how effective are the treatments. From my perspective, as someone over 60, even one that reduces the mortality by 50%, we're still looking at a fairly high mortality rate. So hopefully we'll develop some treatments that work, but really our strategy needs to be prevention. It really needs to be prevention until we get herd immunity through vaccine or very, very effective treatments. And those are also a ways away. A truly great drug would alter some decisions, but may not be as dramatic as we'd hoped. And those trials, you'll see them in the news. Some of them have better outcomes than others, but it's very quick to get to news, and the trials themselves are not necessarily as excellent as we would like. The third question that keeps coming up in the news is, are antibodies fully protective? Can I get an antibody test, and what does it mean? And right now, we don't actually know what an antibody test is going to do for us. We can't use it clinically. So until we have better data on whether or not antibodies are fully protective, we can't use them. So that answer to that question is still being developed. And my answer to that question is, hopefully they will be protective, and a vaccine will be fully protective for those of us who get a vaccine. And also infection will be protective, but we don't know the answer to that yet. The fourth question I get is, how likely are asymptomatic people with SARS-CoV-2, which is the name of the virus, the name of the disease is COVID-19, sort of like HIV and HIV disease or AIDS. So how likely are asymptomatic people likely to spread the infection? We know that they're very likely to spread the infection. In fact, we know that people that have severe disease and the people that have mild disease are equally likely to spread infection. And we know that asymptomatic people, that's people before they get sick, can spread the infection. That's why PPE, or personal protective equipment, is so crucial. When you wear a mask, it may protect you somewhat, but if you're the one who has the infection, you may be spreading it to someone else before you're sick. So the way we protect each other is by keeping distance, by wearing masks, by washing our hands, by having work processes that allow some people to work at home or not congregate in workplaces. all the things that we're getting accustomed to doing out in the world. How likely are asymptomatic people to spread the infection? They're very likely to spread the infection. That's why we have so many cases out in the world when we open up. So as Santa Cruz County and Santa Clara open up so more people can congregate, we will see increased cases, particularly if people don't get used to the idea of how to do this well. Santa Cruz County, Santa Clara County have done a fabulous job of stay at home. And as we go out in the world, I'm hoping we do a fabulous job of protecting each other. We can do that together. The other question is, how effective is social distancing and mask wearing in lowering transmission rates? We know it works well. Every time we don't do it, we see a surge. Those of us in healthcare see it first. For the most part, the cases that we see are the cases that are documented with testing. But we all know that testing has been fairly limited because of the lack of availability of tests in our country. So we have a lot of people that do not have testing, but probably have COVID. So the better we are at protecting from those people that have COVID but are not tested, the better off we all are.
Thank you. And Dr. Forrest, I'm going to cut in there.
Okay.
We will come back to you with the question period. And I'm going to ask our team to share some of the questions that have come in, and we will use our remaining time answering questions that have been shared with us by those participating today. Thank you again, Dr. Forrest.
This first question is for Senator Monning. Senator Monning, can you comment on Governor Newsom's plan of the 6 phases to reopen the state?
Well, thank you for that question. So to be clear, the governor and his medical advisors and scientists have developed 6 pillars or 6 criteria that will be looked at in developing the stages for returning to normal or returning to more business as usual. So to be clear, these 6 criteria don't have dates assigned to them, but they are, broadly speaking, the ability to do better testing, contact tracing of once we know somebody's infected, tracing who else they've been in touch with, and providing support to those who've been exposed. The ability to protect people who have contracted COVID-19, the ability for our surge capacity, meaning for hospitals, medical centers, to handle increased numbers, the development of therapies, the ability to treat, and then the ability of businesses, schools, and childcare facilities to adopt and implement physical distancing as there's a return. The 6th criterion is very, very important. That's the ability to determine if we're moving back too quickly and we need to pull back. So that is one of the criteria, the ability to ongoing assess and to be able to calibrate and pull back if necessary. We will be looking at the 4 stages that are more date specific or will become more date specific. I think I'd like to ask, well, let's go to the next question, and then I think we'll get into those 4 stages. Thank you.
Thank you, Senator Monning. This next question is for Dr. Forrest. Where are we in the process of the 4 stages of returning to normalcy?
That's a great question. Of course, there's a variability by region. And when the governor laid out these various stages, 1 through 4, of which our county, both counties, Santa Clara County and Santa Cruz County, actually Monterey and San Luis Obispo as well, are taking a look at. They're looking at now moving from stage 1, which is basically shelter in place, and looking at readiness for stage 2. And the key indicators are the stable hospitalization in ICU, that our surge capacity for if there is a big increase in those cases, that our hospitals can handle the demand, that we have sufficient personal protective equipment to meet that demand. And of course, there's a bifurcation, there's a duality to that, because the surge protection for protective equipment goes to the hospitals for the most part, and it's not necessarily to essential workers. So the farm workers is a great example of that, where there's not necessarily protection there. Sufficient testing capacity to meet demand. This so far has been done by tier and largely for the sickest patients, which means that we get positives where we expect them. It doesn't mean that we're being able to track community acquired infection. So people that may have COVID, we don't necessarily have the testing capacity for that. And then contact tracing capacity statewide. And this has great variability, whether or not there's funding and the capacity to track everyone who is under investigation, whether or not they have a positive test. And again, there's false positives. There's reasons why we may not be able to know if everyone who has a positive or not. And I think that Dr. Newell actually can answer to the readiness of Santa Cruz County and perhaps Santa Clara County as well for further answers to those questions of the readiness to go to stage 2. Perhaps you could unmute yourself.
Yes, I'm muting. I can speak to Santa Cruz and somewhat to Santa Clara. I think throughout the state of California and the nation, we've had persistent shortages of both personal protective equipment as well as testing capacity. And both of these things are improving. The state has purchased large amounts of personal protective equipment and is distributing that throughout the various local health jurisdictions, as well as testing supplies. So I know that Santa Cruz County, for example, got 5,000 test swabs this week from the state of California, which is a huge help because although we have machines and staff at the ready to do testing, we haven't had the swabs to do so. It seems like a simple little piece of equipment, but that's been what's holding us up with test capacity. In addition, the state has distributed 80 test sites throughout the state of California, and Santa Cruz County has been fortunate enough to get one, as was Monterey and San Benito. These were located in places called testing deserts, where testing has not otherwise been available. So one of these will be located in Watsonville in Ramsey Park, and will begin operation next week through a company called OptumServe, and they will collect up to 132 specimens a day, which will be sent to commercial labs for processing with a rapid turnaround time of approximately 48 hours. So we're very grateful to the state for that kind of a response.
Thank you, Dr. Newell and Dr. Forrest. This next question is going to be for Dr. Newell. Can you expand on the recent shelter-in-place order with how groups of children are able to gather and why are other groups not able to do that?
We recognize that having our children out of an educational system is difficult, and the longer we go without school and without the safety and security of a school system for some families, that it becomes more critical. Schools are not just schools to many of our families in our communities. They're also where they get fed, where they get medical services and social services. And we recognize that the longer the schools are not in session, the more difficult it is for our local families. So that's part of the reason is we're trying to meet that need. We also recognize that young people are less vulnerable to complications, including hospitalizations and death from this virus. And for that reason, we feel better about doing that. The kind of educational and recreational activities we're talking about would be in a stable group of 12 children maximum. That means there's not changing of classrooms or changing teachers. So it would be the same group of children for a long period of time, at least several weeks, with the same 1 to 2 teachers or staff members. So it's a very different kind of recreational or educational setup than we've had in the past. I know in Santa Cruz County, we're working closely with the County Parks and Rec Department to develop a summer program that falls within these guidelines. And the cities and Boys and Girls Clubs and other organizations are doing the same.
Thank you, Dr. Newell. This next question is for Senator Monning. Within the 17th Senate District, especially Santa Cruz County and South Santa Clara County, are noted as tourism destinations. Can you touch on how COVID-19 has impacted this industry within your district?
Well, thank you. Our tourism hospitality industry is the second largest employer in the 17th Senate District, and it's perhaps been the most devastated industry. We know that agricultural workers have been deemed essential, and many of the agricultural jobs have continued in food production. But in the hospitality industry, hotels, restaurants in particular, we've seen virtually an overnight shutdown, workers going from hourly wage paychecks to no paychecks. That's where we've tried to maximize the response time or minimize the response time for unemployment insurance benefits. We've been working directly to try to provide that support to the employees. To the owners, we've been hearing many have been innovative in the restaurant industry in providing meals for pickup. And now the governor has just announced a program for qualifying restaurants that could provide delivered meals to seniors and at-risk population in a program that they would be reimbursed by the state of California for providing that emergency food service to at-risk members of our communities. That said, that program alone will not be enough to bring that workforce back to work soon or that industry back to full volume. It is dependent on tourism. And one of the issues of stabilizing our communities is to minimize those coming to our communities from other communities, whether it's Southern California, New York, other countries. That's how the virus can be brought into our community or infect people that have up to now benefited from the shelter in place. So as part of the criteria for reopening businesses, there will be an ongoing review of mechanisms for reopening businesses, probably with physical distancing being one of the requirements, and the ability to pull back if there's some, as there is reopening, the ability to monitor and make sure we're not creating greater risk or seeing spikes in the infection. And just to close on that point, I know it's been a tremendous hardship to some of our small businesses. In addition to the unemployment insurance benefits through our federal government, there's been Small Business Administration loan programs that are still available through the second supplemental vote of Congress. And while again, those wait times can be frustrating, there's also some state of California programs available to small business owners. Patience is going to pay off. I will just close on this note. The sense of urgency that some are manifesting now, that we really need to get back to business. I direct you to our history, 1918, 1919, the Spanish flu pandemic. More people died in the second wave of that pandemic than in the first wave. It took the lives of over 50 million globally, took the lives of over 2 million Americans, and more died when people rushed to go back before it was safe. So it's going to hurt in the short term, but we will minimize the long-term impacts if we obey the scientists, the public health experts, and do what we've been doing that is actually working. We have the proof. Let's not spoil it by being too anxious to get back to normal. Thank you.
Thank you, Senator Monning. This next question is for Dr. Forrest. If you are asymptomatic, will you eventually present symptoms, or will you stay, or is it possible you will stay asymptomatic the entire time?
That's a really interesting question. And so far, the studies that have looked at the asymptomatic populations have been snapshots. So they'll do testing across a population and snapshot, and they'll see asymptomatic people, and they'll be for prevalence. But if they've tracked that group out, many of them, and it's variable by population, will eventually get symptomatic. And the symptoms vary by human. So some people have a very mild case. Some people, and also mild, by the way, can be pretty brutal. It can be loss of smell. It can be flu-like symptoms that last for weeks. It can be neurologic symptoms. These are mild. These are people that are instructed by my colleagues to stay home and are not tested. That's a mild COVID case. A more severe one will be in the hospital. So we don't know exactly because we're not studying that population. The population that's studied are COVID positive, and because of the narrowness of testing, and this is no one's fault, this is because of the narrowness of testing, is because of the limitations of testing, are only the ones that prevent very severe. And we have the highest percentage of positives because we need to save the ones to be able to identify them, to treat them and find them. But as we get increased testing and get a better handle on it, we will understand better the natural history. And probably there will be some people who are carriers and can be asymptomatic and never get the virus and pass it on. And the younger you are, probably the more likely that that's possible. So for instance, for children, they may not have it or have a very mild case, but they may bring it to a grandparent who has a severe case. That is actually something that the public health people are considering. I know Dr. Null's on her mind. It's part of the reason why they're thinking of smaller cohorts, and using social distancing to protect kids from one another. So the short answer is, we don't know. The longer answer is, we suspect that that is going to be in the continuum. And it's why this emphasis, this intense emphasis on the pillars of how are we going to do this going forward? How are we going to stay home? How do essential workers be out in the world and the rest of us figure out how to do this better? How do we wear masks and how do we make them? Right now we're counting on volunteers. That's not sustainable across an entire nation or the world for all that matter. We're only talking about the nation, but this is a global problem. How do we do things from a distance to one another? What does hand washing look like every day, everywhere? How do we do this together with joy? And I don't know the answer to that, but I do believe in the ingenuity of my people.
Thank you so much, Dr. Forrest. We have another question for Dr. Newell. There's some questions about how the shelter in place is being enforced and what is being done about people from outside of Santa Cruz County and Santa Clara County coming here, specifically Santa Cruz for the beaches.
Thank you. In Santa Cruz County, we are very fortunate to have law enforcement who are absolutely supportive of our shelter-in-place orders and other health officer orders, and have been doing a fantastic job enforcing those orders. They really believe in what we're doing and understand what we're doing. I'm sure it's the same in Santa Clara County. As far as travel and limiting travel to the county, it is the governor's directive and the state health officer's orders that we stay at home except for essential travel. And essential travel is very narrowly defined. So mostly we really should be staying home at staying in our own neighborhoods. There have been many ideas raised about how to keep people away from our beaches and out of our counties, and most of them are unconstitutional. For example, locking down the borders. A couple of California counties tried to do that, Mono and El Dorado, for good reason, because they're very small counties with very limited healthcare resources, and yet they are mountain getaways, and so large numbers of people have second homes in the mountain areas and want to vacation there or spend their shelter-in-place time in those homes. But those counties can't accommodate them in their healthcare system. But those counties were both required to lift their restriction because that was not constitutional to restrict movement in that way. Same with considerations about limits to recreation, as San Mateo has done, of setting a 5-mile limit. My county council at least is telling me that we can't restrict movement in that way. We can't start stopping people on the streets and asking for their identification to prove that they're locals. What we have done is made clear in this most recent shelter-in-place orders to short-term vacation rental companies, hotels, motels, inns, bed and breakfasts, etc., that only essential travelers can be booked, and that they must keep a record for law enforcement of the essential travel activity for each traveler that they book. And so we're hoping that that's going to help. We've also made clear that penalties, including fines, may be impinged upon not just the owners of the hotel, but the operators and the travelers themselves. So we're really trying to crack down on overnight stays.
Thank you, Dr. Newell. We have another question for Dr. Forrest. How are we protecting our healthcare workers? Oh, if you can unmute. Thank you.
Thank you. This is a good question. And again, it varies a little bit on where you work, what your access is to equipment, and it's varied a little bit by state. So as Dr. Newell mentioned, our governor has made great strides to try and get access to the certified personal protective equipment, or PPE, that's necessary for people that are at high risk because their essential work takes them close to people that are sick with COVID and at our highest risk. So those are surgical masks and N95 masks. And that protection really should be reserved for people that are at highest risk, healthcare workers, first responders, people that are in that vein. Right now, if you're working in a big system, you might have access to that. In my experience, when I was first starting to work in this area in our counties, this included Santa Clara, Monterey, and Santa Cruz County, it was more difficult to get access to that kind of equipment if you worked in smaller areas that weren't part of one of the surge systems, part of the emergency systems. So we did quite a bit of work to try and get access immediately because, again, people that are presenting with symptoms present in primary care. They don't present necessarily in hospitals, and that's still the case. So it's variable, access is variable because of the shortage that's not just our area and not just our state and not just our country, but global. There is still a shortage. And even when we say we have access to this, what that means, for instance, when I go to work at Natividad, is I use the same mask and I take it home, carefully doff it and sterilize it and reuse it. I am a primary care provider in a safety net hospital, and that's what I'm doing, and that's what the nation is doing. So am I protected? I'm doing as best as I can, and that's what everyone's doing. So the question is a specific question and a general question all at once, which is that the certified equipment should be reserved for people that are highest risk. And there are levels of protection. So when we say, for instance, in the face covering law, and the CDC said this, that people that are going in public can use a face covering such as masks or bandanas or t-shirt over our face, that's because our risk is slightly lower when we're just going out in public. We're not at the highest risk as some of our, for instance, Senator Monning is showing us a bandana. Nice. Points for that. So there are various levels of risk. There is actually tremendous innovation happening now in in protective equipment. For instance, right here in the Salinas area doing work in Watsonville, Chiampa is a small innovation group doing biodesign, and they're trying to figure out what will work for farm workers who actually are at risk, working closer than 6 feet, exerting, and at high risk. So there's innovation right now in personal protective equipment that may have impact on healthcare workers as well. So I'm not being specific in my answer because it varies tremendously on where you work.
Thank you so much, Dr. Forrest. We have time for one more question. Senator Monning, this one's for you. Could you maybe talk about what you envision for the future as we open back up, and any final thoughts?
Well, thank you again. I want to thank all who joined us this afternoon, and especially our guests, Dr. Newell and Dr. Forrest, for sharing so much timely and good information that will hopefully inform us in our ongoing work in our neighborhoods, our communities, in our workplaces. The state of California is working full-time. We will go back into session on May 11th in the state Senate. We have to work on a budget where we anticipate reduced revenues. We know there will be reduced revenues. The governor will release his budget, a revised one called the May Revise, on May the 14th in 2 weeks. And we're going to have to make some tough choices. One of the things we have benefited from, with a reserve of about $20 billion from the prudent budgeting over the last budget cycles, we've been able to devote necessary immediate funding into healthcare response to COVID-19 to the tune of about $7 billion. We will be dependent on ongoing federal support to be able to meet some of our obligations to all residents of the state of California. But again, I want to give a shout out to Governor Newsom and our medical officers, our California Department of Public Health, Health and Human Services, our Office of Emergency Services, so many who have pulled together and each day adapted and mobilized resources to try to address problem areas, to try to build up our medical infrastructure. We have been able to build up what's called our surge capacity throughout the state of California, so that we stay ahead of this and that we do it with confidence, with good planning, and with reassurance. I think one of the things we can all do as residents in our communities is to project respect for one another, project calm, and to remind people of the importance of wearing masks, not so much for our own health, but protect others should we be carrying the virus and not be aware of that. It's really a compact of social responsibility. My wearing a mask is a signal to my fellow residents and citizens that I care about them. So let's look at the mask as a messaging to others that we care about them, and we're doing our part to make sure they are healthy. I know we're running up on time. I do want to share a website that went up this week from the state of California. It's called COVID-19, all together, COVID-19, CA, gov, G-O-V. So COVID-19, CA, gov, G-O-V. That website provides daily timely updates on the control of the virus in the state of California and other valuable updates, including the health orders we've been talking about today. For those of you, I know we had a lot of questions that we didn't get to. We will try our best to post answers to some of those. If you have friends who weren't able to participate today, we will be posting this session in a couple of days. It will go up on both my state Facebook and on my state Senate website. You can just Google Senator Bill Monning, and you can direct friends and associates to hear today's conversation, as well as to get some further postings of answers to some of your questions that we didn't get to today. So with that, again, I want to thank you all. I want to urge you to be safe, to be well, and to applaud all of you who have been standing together but physically distancing, but standing together as communities to engage in best practices, to let science be our guide as we navigate towards better days and look back on this as a terrible pandemic, but one that we responded to with the most current public health advice and inputs, and that we each did our part to protect our neighbors and our family, particularly elders in our families, from unnecessary exposure and disease. And so again, thank you all for joining us. Thank you, Dr. Forrest. Thank you, Dr. Newell, for the work you're doing. And please share our thanks with your associates and colleagues who are also working long hours every day to protect our communities. So again, friends, be safe, be well. Thank you for joining us this afternoon. And thank you to our staff for their organizing. Have a good evening.